Hi friends, I am Dr. Rahul Bhargav, Director of Hematology and Bone Marrow Transplant at FMRI Gurugram. Today we are going to talk a very burning and a very pertinent question. Why myeloma patient requires bone marrow transplant? Three things, my friends. Multiple myeloma is a non-curable disorder. It is a controllable disorder. Any drug which increases the PFS, which is called progression-free survival, which means that ability of one drug reaching from one drug to another drug and increasing that duration is what is called as PFS. And third, the most important thing, as the time is progressing, so is the science and so is the resources of a mankind which is bringing new medication. If I go in 2004, there was only one medication called VAD which was used in 1972. Multiple myeloma, the only thing which was bone marrow transplant, but it used to give a progression-free survival from one drug to another drug. Second drug was only 20 months, which increased to 30 months by the discovery of newer medications like VRD. And then came an era. In past 1 decade, the daratumumab plus VRD increased the PFS with bone marrow transplant to 70 months. Yes, you heard it right, 70 months. And that is why, my friends, you require bone marrow transplant, because it is the most effective, most affordable, easy way, one-time process which increases your survival to 70 months, which is more than 5.5 years. So that is why, my friends, bone marrow transplant is the important choice, the frontline choice for people suffering from multiple myeloma up to 70 years of age. And it is affordable, it is not expensive. 14 days in the hospital, it does not lead to the mortality, except only when 1% of people who are very sick. But up to 70 years of age, autologous bone marrow transplant, unlike allogenic transplant, it is safe, it is easily done, no major complications. It can be done at centers like FMRI alone, which leads to higher survival. So what are we waiting for? Every single multiple myeloma diagnosed with multiple myeloma in 2026 should opt for bone marrow transplant at FMRI. Thank you.